welcome back to another episode of the Digital Health Podcast. Hey, we have an amazing episode for you guys today. If this is your first episode and you don't know who we are the Digital Health Podcast. I'm Anthony Virgo. I spent the last 7 years at a health tech startup, and now I'm building my own AI automation agency along with my co-host Kazar. Kazar, go ahead and introduce yourself.
Hello, everyone. Welcome to another amazing episode with amazing guests in the Digital Health Podcast. Let me introduce myself for the brand new to this podcast. I've been working in the healthcare domain for quite a while. I started with the dental practices, and then we collaborated together. And now we are working with psychologists, we are working with physiotherapists, we are working with cardiologists, dentists, and a lot of other healthcare professionals. So this is the brief introduction about me. Now I want to kick it over to Dr. Rick.
All right, great. Yeah, I was just invited to be on this podcast with Anthony and Kazar. Happy to be here. I'm a clinical psychologist, doctorate, licensed in state of Vermont, which is in the northeast of the United States. Also licensed in New York, and I spent 13 years in New York City. So, Anthony, I know some of the healthcare systems that you worked in because I worked in those as well. Mount Sinai and Columbia Presbyterian, and
Oh, yeah.
yeah, all the major hospitals, NYU, Lenox Hill Hospital, yeah, you name it.
Oh,
I was part
yeah,
of those. I was training physicians actually. I started my career. I got my license in alcohol and drug counseling, so I was in the addiction field, and then I started training physicians in how to recognize and address substance abuse or substance use disorders in primary care, in
yeah.
hospital settings and clinics. And then I went on to get my doctorate in psychology and moved back up to Vermont, where I'm from, and have a private practice up here. And really interested in digital technologies and AI. In fact, I testified in the local state house here in Vermont on the use of AI in healthcare and what that means for people. And so I'm just delighted to be on your episode with you.
Definitely, definitely. Again, thank you for your time. I appreciate it. So it looks like we have a few things in common because we have that New York expertise, but I'm also a New Englander as well. I'm from Connecticut originally, so
All right, all
Vermont
right.
is right up the way.
Yeah, yeah, cool, cool.
Yeah.
I think
And
I think this episode is gonna be a little bit different from the rest of the episode because
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 right,
of
man,
the
we got
Right.
this is the first time I had a New Englander. A lot of everybody else is from everywhere, so it feels good. We already have that rapport there.
Yeah, yeah, that's
uh,
nice.
no worries. So Rick, we usually start the podcast off by pretty much asking one question about how did you get into this healthcare industry as a whole? What sparked your interest? Where were you at your point of life where you said, "Hey, healthcare is going to be the journey that I'm gonna walk the path on"? The reason why I ask is because I it's almost a similar scenario for a lot of our guests. It might not be for you, but it's been the same for me. I kind of fell into healthcare by accident. I started off as a car salesman. I was in Connecticut selling cars. I moved to New York and I got into healthcare. And I often tell people, like, when people say you came from the car business into how does that interchange? And I often say I stopped wanting to screw people over and I wanted to help people. So that's why I came into that healthcare industry. But what was your journey? How do you actually come into this industry, and then how did it motivate you to go and get your doctorates to pursue more and then keep and even opening your own practice? Like, what was that like?
Yeah, it's pretty straightforward actually. A lot of people when you're younger, you don't know what you want to be when you grow up. In fact, I talk to people in their 50s and 60s and they still don't know what they want to be when they grow up. But I was one of the, I suppose, fortunate ones where I knew pretty early on. I was interested in mental health, interested
Mm,
in how the mind works. I had some experiences when I was a kid that opened me up to different ways of thinking about people and behaviors and mental health and stuff. And so I was fortunate enough to, go to college, and I started my academic career studying psychology in New York City, again at Columbia University. Got my bachelor's degree in psychology, and I was going to go into medical school. I did not go the medical school route because it seemed like a very long journey. I was looking at another 10 years of education after undergrad. But no, I kept pursuing mental health, and I went and got licensed in alcohol and drug counseling. And while I was getting my education and license in alcohol and drug counseling, I was working for an alcohol and drug rehabilitation center down on the Lower East Side of Manhattan. And while I was doing that, I decided to apply and get my doctoral degree in psychology because I really do think when it comes to addiction and mental health, the two go hand in hand. It's hard to separate the two. You know, people who have addiction probably have mental health issues, and some people who have mental health issues can fall into addiction. And so knowing about both fields was really important. And then I even took it one step further, Anthony and Kazar, and I went and got a master's degree in psychopharmacology because even in the news today, we hear RFK Jr., you know, the Maha movement, they're talking about deprescribing. It was in the New York Times, deprescribing psychiatric medications because too many people are on psych meds. And so one of the things I wanted to learn about was psychopharmacology. I'm a mental health provider, and I thought it was important to know that. So I'm a little bit of a school junkie, went to school forever. And so I didn't really fall into the healthcare field. I really knew that that's something I wanted to do, and I've been at it for over 25 years now.
It's interesting. I'll be honest with you. You are the first guest I think that might have had that straight and narrow path like that. I'll be honest with you. So I'm impressed. I guess what was it? I think I mean you know how New York is, and you know I think even the community or just there's such a taboo about mental health or stigma, and for a long time it just wasn't talked about or was looked over. What was it about it specifically that kind of you were drawn to it? I know you said you were interested in how the mind work and mental health, but I think I feel like today, at least in my lifetime, today is now the time where people are actively talking about mental health. But before, I can't even imagine a lot of people even, talking about it like that. So how did you kind of I guess fall in love with it, or spark, where did that interest spark for you, since it's been such a taboo or kind of under wraps, especially for men? If you think about men's mental health, how did you get into it?
Yeah, I mean, it's pretty simple. I was saying before when I was a kid, I got interested in the mind and behavior because I had my own issues with alcohol and drug use in my teen years. And
Mm,
so, falling into that crowd and falling into that scene of drinking a lot, using a lot of cannabis, using a lot of
mm,
other drugs, and very fortunately, I was able to get out of that scene at an early age. But it was
mm,
because of those experiences that I got interested in mental health and addiction. So it was really I got into it through addiction, and then I added the mental health piece on top of the addiction piece because of my own story, my own experience with addiction. I've been sober from alcohol and most other drugs for the last 33 years. And
congrats.
so I've continued my journey of recovery from addiction, but also, along the way, just a lifelong learner, trying to help people understand how their mind works, change behaviors to get them to be healthier. I think, in Manhattan, New York City, Anthony, I do
Mm,
think it was pretty popular back in the day. People were like, maybe for the worried well, the more wealthy people, like, who's your therapist? You got a therapist? What did your therapist say? That kind of thing. So
right.
there was something back then in certain, cultures in New York
Areas,
City,
right.
but in rural areas in, New England and around the
Right.
country, certainly in, Midwest and a lot of places, you're right, a lot of taboo. A lot of, you don't talk about your mental health. You just pull yourself up by your bootstraps, especially if you're a man,
Right.
just, get over it, stop being a baby, just, move on, that kind of stuff. Now, there's still some of that out there. Obviously, I don't think that'll ever go away, but,
Hmm.
mental health is getting a lot more attention. People are starting to understand more about it more publicly, and I think that's really helpful.
Definitely, definitely. So earlier you said something about substance abuse, and I think in at least in my experience, and then some of the health systems that I work with, you mentioned how if someone might have a mental health issue, they might have a substance abuse issue, and then vice versa. And that's interesting to hear because this is probably the first time I've kind of heard that out loud like that. Of course, we kind of know through like working with patients and stuff like that, but I think that's like maybe a misconception that a lot of people don't even realize or even know about. But I was gonna ask, what's another misconception about maybe substance abuse and mental health that someone might not know about? Because I just learned something new from you just now by even saying that. At least like openly, like people should openly know that for a fact that these things could be in some way, shape, or form affected by each other, and then it could cause the same kind of conditions.
Yeah. Well, it's a good question. One of the things that's very popular nowadays that people are paying a lot of attention to, and that's trauma. So we've heard
Mhm.
about post-traumatic stress disorder,
Right.
traumatic incidents where, I was in New York City during 9/11 when the Twin Towers came down.
Oh wow.
I work with veterans who have been in combat in the Middle East, and you hear about people who are victims of sexual violence and sexual abuse and childhood trauma. So trauma is a big topic. And I think one of the misconceptions is that if you have a substance use disorder, if you get addicted to a drug or alcohol, well, it must mean that you have significant trauma in your life and you have to address the trauma. And if you don't address the trauma, you'll never be able to stop, using alcohol or drugs. Well, it's just not true statistically that everybody who has a substance use disorder also has trauma. Of course, yes, some people are predisposed to turning to alcohol and drugs to help cope with their traumatic past, incidents that happen there, to regulate their nervous system somehow, to use alcohol, to use nicotine, to use drugs to do that. But, the fact is that not everybody who goes on to develop a alcohol or drug problem has had severe trauma. We've all had some kind of trauma in our lives. Our dad didn't show up at our baseball game, or, our favorite grandfather, grandmother died when we were young, or, we've all had experiences that are upsetting and difficult. But does that mean it's, to the level of, severe trauma and that we need to, use alcohol and drugs to deal with that? That's not really true. That's a misconception. I think a lot of people are, confuse the fact that we can have trauma and not have an alcohol and drug problem, and we can have an alcohol and drug problem and not have trauma. So I think it's really helpful to have education and awareness in both areas, mental health and addiction, and know when to address one problem, address the other problem, and not just exclusively focus on one or the other.
Right. Oh man, that's amazing. I think that's spot on and good to know for people, for the average person to kind of dissect and understand, especially in this climate, because you would automatically think because someone is has substance abuse or mental health that they are dealing with some type of trauma when that's not necessarily the case all the time, right? It doesn't
Right. Not, I
it
mean, in a lot of cases, yes, but not all the time. Yeah, yeah.
Right, right. A lot of times it could just be you versus trauma. I think there's things also like risk factors that might, lead you to that way. That's not necessarily trauma, but you're just the likelihood of, if you're being around so many people who drink and smoke all day, you're probably going to drink and smoke. I'm not going to say you are, but you're probably going to go down that route sometimes. So
Yeah,
that's
they say you hang around the barber shop long enough, you're going to get a haircut. So,
right.
you hang around those kind of people, you're, probably going to dip your toe into that water. And, for some people, they're more at risk for going on to problems. And some people, maybe they use nicotine or alcohol a few times and they decide it's not for them. But some people, because of their risk factors, it becomes a real problem.
Right, 100%.
And
Earlier,
Dr. Rick,
yeah.
I would like to talk the technology aspect in the psychology. Like you have been in the New York, now you have been working in your city. So how what are your observations regarding the acceptance of technology, and then specifically regarding the acceptance of AI in the psychology practices in both these cities?
Yeah,
So what are
I
your
think that
observations?
Yeah, that's a great question. Because this is a digital health podcast, and I've always been one to be kind of an early adopter. I love technology. I love to learn about it. I really think it can be helpful for people. I think if you look at it through the lens of, let's say, mental health practitioners as a field. So you got these people who are helping other people try to overcome their problems, get better. You have younger generation of counselors, social workers, therapists, psychologists. Younger generation is much more likely to adopt technology and integrate it into the healthcare, into how they do their work. You have older folks who are, maybe in their last 10 years of, I mean, I'm getting there myself, gray beard and everything, but, you get to the last 10 years of your life or your career, and you think to yourself, well, I've been doing regular talk therapy, taking handwritten notes, or, just taking notes on my computer or something. I don't need all those bells and whistles of what AI can do. But let me tell you, I mean, I have an electronic health record, Simple Practice. I'm not advertising for Simple Practice at all, but they have integrated into their electronic health system AI note taker, and you have patients consent to having the AI note taker available. You have to go in after the session and you have to edit it. You can't just let it go without editing it. And so you look over the note, and that's just a very low hanging fruit, very basic level of AI integrated into the clinical workflow. But I know, like Anthony, you're talking about, and Kazar, I know there are things like Weave and other AI programs that they run your whole practice. They can do the intakes, they can check the insurance, they can field all the calls and return calls and texts, and all that stuff is automated. I haven't gotten there yet. I think larger clinics, larger practices really can benefit from leveraging those AI tools. But as a smaller private practice, I do have an educational component of my work. I haven't really integrated those bigger and broader tools, but I'm always playing around with, see what ChatGPT and Claude and Gemini can do to help me, make my workflow more efficient. You have to be careful too, because I think a lot of people are concerned, and maybe you guys can speak to this. A lot of people are concerned if they put any patient data into the AI brain, so to speak, that somehow someone is going to be taken advantage of, that their personal information is now going to be commodified and sold on the internet, and their personal stuff is going to be spread around. And I think a lot of older generation people are still really scared of that. And maybe, maybe some younger people are too. Some of the AI developers are, send out warning signs once in a while that, AI could be dangerous in some ways. That movie that just came out, the AI doc that people are starting to watch now, the Apocalyptimist or whatever that is. So I think there's two sides of that. There are some people who are afraid of AI and integrating into the workflow. I'm a little bit more into trying to see what it can do to help me and help my patients, because it can help patients too. One of the things, Kazar, is that I have patients coming in and they're already consulting with ChatGPT about their depression, about their anxiety, about their addictions, and they're going back and forth at home asking ChatGPT and Claude all questions about, how do I deal with depression? How do I deal with that? So now we have to ask patients, like, how much are you using ChatGPT to help you with your problems? And that's just commonplace now.
And by the way, what are the new, you can say, AI related technologies that you are using in your practice to enhance or to improve the patient experience?
Yeah, I really don't. I mean, there was a time where there was this thing called Limbics where I used this virtual reality headset and to help someone with anxiety around driving. So it was a driving simulator. It's not really AI, but it's technology, where someone would have a driving simulator, and I would walk them through relaxation exercises while they're virtually driving a car to try to help reduce their anxiety and get them used to driving again after a car accident or something like that. And we're going back 10 years now. I tried that with a couple of patients, but not really integrating it too much. It's really, I use Zoom for telehealth. And I don't have anything transcribing over Zoom. I have my electronic health record recording the session for note taking, but I don't use any technology here in the office, other than it's just talk therapy basically.
By the way, that's one of the amazing use cases of the virtual reality. Like you mentioned, you were using the VR headset. to train some patient or some client to, like, if he or she is scared of the driving. Like, I haven't heard this use case before. That's one of the amazing use case. Yeah,
Yeah.
really.
I
Yeah.
said that gotta be popular in New York. There's so many New York drivers that just don't drive. It got pretty sure your door was going. See, they're so used to the train that it's like my wife, for example. My wife, born and raised in Brooklyn, but she does not drive at all. She gets anxiety getting it behind the wheel. But that A train, she's perfect on it. You know what I mean?
Yeah. Yeah.
It takes some getting used to, and I think that's really what it is. Earlier, we were having a conversation with another provider where they were saying that exactly what you were saying, Dr. Rick, is, there you have people who are starting to bring in not necessarily their transcripts from their chat GPT, but they're saying, hey, well, I was talking to chat GPT about this, you said that, and now there's is there two clinicians in the room or two clinical people? Like, chat GPT isn't, a clinician, right? But it's kind of like when WebMD first came out, everybody was self-diagnosing themselves. And,
Yeah.
I think ChatGPT is kind of going through, or just AI in a sense, is going through that same kind of phase, especially in healthcare where people are like, can I just use this as a second opinion? What is it going to do? And that's where I think that's, the scary part. Earlier you were talking about like patient data and stuff like that. And I think that's what it takes. This is where a human will come into play with AI and with optimizing AI, because we often say, Rick, is, the way we do AI, we're in the healthcare system because we come from healthcare. It's not like we're going to do AI for like restaurant or something like that. That's hospitality isn't my lane, so I wouldn't even, I'm not an expert in that niche. When we're talking to healthcare providers, we often say, hey, if you're worried about compliance, if you're worried about HIPAA, if you're working with someone who's doing AI, I hope the AI person comes from the healthcare background to understand, how HIPAA even works. So even what you're saying, yeah, we've built things HIPAA compliant, right? We can make sure that it's internally secured with the practice, and then it deletes after 7 days, and only certain providers have visibility into it. There's certain ways where you could design it HIPAA compliant, but if you have someone who does not come from the healthcare background, don't know how to navigate HIPAA, then you're just dealing with somebody that's gonna give you solutions that isn't gonna solve the problem but create problems, if that makes sense.
Yeah. Yeah.
1,000%.
Absolutely. Yeah. Yeah.
1,000%. So I mean, going back into the AI side of things, where I guess there's certain providers that we've talked to that it's the same thing. They're on the spectrum of, I don't like AI, forget about it, this is not a good idea. And then some people like yourself who are in the middle playing around with it, see the best use case scenarios. And then we have people that's like, yes, AI everything so I can, live my life and hands free kind of thing. So it sounds like you're a little bit in the middle. Is that correct?
Yeah, yeah, that's correct. I think there is real concerns out there for mental health providers that there are people getting advice, and there are glitches in AI and ChatGPT. You hear horror stories about someone developing a relationship with ChatGPT, and ChatGPT convinces them to commit suicide or smoke crack or do something, like you think, what? Why is this AI telling him to do this, crazy stuff? And so, there is some fear, some legitimate fears out there that this is happening. And I think what the concern is mostly autonomous chatbots. I think is when you have an autonomous chatbot that is operating as if it is a legitimate mental health provider, or putting itself out there as a mental health provider, but it's really just an AI chatbot that the person's speaking to. And that's really kind of where I think some people are very hesitant. There's a lot of bills in various state houses across the U.S. There's social work organizations and other healthcare organizations that are getting lawmakers to pass bills in their states banning the use of chatbots for mental health purposes. And that's something I testified here in Vermont on. And like you said, falling in the middle somewhere. Like we don't want to be hamstrung. You can't just ban AI and expect us to continue to do our jobs, because AI is like the internet. AI is like running water. It's like electricity. At some point, you can't just ban us from using it, because then we can't even practice our profession. But there are guardrails out there, I think, legally, that can be instituted to help people and patients not take advice from like a completely independent AI agent. And I think that's smart. That's smart policy, I think.
Definitely, for sure. And I think those are uh, that's what makes, I guess, humans important, right? To set up those guardrails, right? Like, who's gonna be the one asking these type of questions to make sure that AI is abiding by these rules and these standards? Because you're right, it's like water. It's like it's like it kind of came overnight, and now we can't do nothing about it because
Right.
it's already here, right?
Yeah.
It's already running wild. Now we gotta give it street lights, give it police, get police it a little bit, and
Yeah.
say, come back inside a little bit during this during this time.
Yeah.
It's like the Wild West almost, the way AI has been implemented so fast.
Yeah.
Especially in our industries, right? If you talk about healthcare, it's like it's all over the place, so fast, almost overnight. My company, that was when my company, I think maybe 2 years ago, is when they started to go full force into AI, having consultants and things like that. And even then, I thought it was like, I was like, man, AI isn't gonna do it. But now we're here today, and I'm like, whoa, like AI is doing a lot of the back end right now. A lot of, a lot of the day to day. Like, I see a lot of the benefits. To me, the benefits outweigh the negative for sure, but also the negatives could spark something, something crazy, and like you said, in the crazy scenarios where AI is telling people to do crack, or they're having a real relationship. I think those are the extreme scenarios that I think we're going to see a lot of in the future because of AI. And it's just like, how do we plan for that, right? If somebody comes into, your practice, and, I think AI is being seen through a similar lens of how social media was first seen, and how social media is seen. Like, if you think about someone who wakes up in the morning and scrolls social media, that's the first thing they do, and then all they see is something negative, then it's like, obviously that's going to affect your well-being in some way, shape, or form. Same with AI, right? The way you're interacting with it, what is it telling you, things of that nature, for sure.
Yeah. Yeah.
Yeah.
Absolutely.
Rick, so one of the last questions we ask people is, in your industry, in the next 5 to 10 years, where do you see this technology living? I guess the broader question here is, how do we adapt to this technology while also keeping, like, the human aspect of things? Like, AI isn't gonna be the one that's tapping you on the shoulder, telling you had a good job. The actual tapping, right? The physical touch of someone could mean the world, to a patient, right? How can we, like, adapt to this in a sophisticated way to where we both could coexist, right? The providers, the thought leaders, and AI all in one. What are your thoughts about that? Or what do you see the landscape in the next 5 or 10 years?
Yeah. I mean, I think what you hit the nail on the head, to use a well-used expression. Exactly right. That, how do we keep the human alive and thriving and live and well and integrated into the AI system, not the other way around. I think that's where we're seeing this shift. We're shifting from how do we get AI integrated into everything, and then that's going to shift over to how do we get the human, make sure that the human is integrated into the system. And in the mental health field or in the counseling field, I really think that, one thing that I'm excited about, and this may be on topic or a little bit off topic, but what about holographic images? You remember like the old Star Wars movies where Princess Leia comes out of R2D2 and leaves a message, and it's a hologram that shows up like right there. like I haven't seen that technology yet. Like, why is it that I can't have a patient sitting in their living room instead of being on Zoom? They get beamed, holographically right into my office, or I get beamed into their home and we have a conversation. So there's AI and technology and human interaction like blended pretty well together, I think, in that scenario. Really make it lifelike and really make it even more real. Like I'm in the room with them or they're in the room with me, even though we might be thousands of miles apart. So that's just one small area. I think in 5 years, that would be cool to see therapy where someone, it's not just on a screen anymore. It's actually a three-dimensional life-size image in your office. And I don't think that's that far out. I really think that would be a cool way to keep the human element into it. And yeah, I mean, there's an infinite number of possibilities. It's hard. You just said like it's the Wild West. The speed at which technology is advancing is hitting a exponential curve right now. They say there's that movie, The Singularity, that, that's it's coming. And so it's hard to predict, in 5 years, that's in technological terms, that's like, 100 years, progress in 5 years. So, hold on to your socks.
1,000%. And I think, yeah, we're not far out. I'm even like, that's a really good idea. That hologram idea. I'm like, wow, maybe we should pivot from the agents because
By the
I
way,
don't really like the
by the way,
hologram idea.
I have noticed one thing, that the use cases of the AI and the technology that Dr. Rick has in his mind are mind blowing and amazing. Like like the holographic, like the VR virtual reality for the patient to learn him how to drive. They're amazing.
Yeah, we might have to make a pivot after today or incorporate that somewhere.
Yeah. Yeah, it's just so many possibilities. It's really fun to get creative and think how this can really help people. I like what you said, Anthony, before. I lean more on the positive side of things. I think, the benefits outweigh the risks, but we do have to be careful and we have to figure out where are the guardrails, where do we need to police each other, and try to stay on track. Otherwise, things could go sideways, but ultimately it'll all work out in the end. I don't know what that's going to look like.
Right, 1,000%. We're all optimistic here. I
Yeah.
think so. Yeah. So, where can people connect with you? What's the best channel to kind of either, the listeners might have a question or want to reach out or just connect with you? What's the best way to contact you, if someone's not in Vermont?
Yeah. So I think I was found by you guys on LinkedIn, and I am on LinkedIn quite a bit. It's one of my preferred social media platform. People can direct message me on there. I'm pretty engaged on Twitter X as well. Not so much on Facebook or Instagram, but I'm on there all the time. People can find me with my name that's on the screen there, and they can hit me up with questions. One thing we didn't talk about was this whole thing about psychedelic medicine and research, LSD and mushrooms and ecstasy, those kinds of things. And that's
Right.
one area that I'm really focused on these days, which is in some ways, separate from, it's a different kind of technology. Let's put it that way. Uh, but yeah, definitely find me on LinkedIn or X, and happy to connect with people.
Definitely 1,000%. I think we're happy to do a part two and talk, ask you more questions about like the psychedelic society and stuff like that for sure. I want to dive deep and see what it's like up there in Vermont and the cool things you guys are doing.
Yeah, cool. Thanks.
Definitely, definitely. So thank you guys for another episode of the Digital Health Podcast. Rick, thank you again for your time. Till next time.
All right.